Hello, everyone. My name is Marty Guthmiller. I'm CEO of Orange City Area Health System, bringing you today on February 8th, 2021, the 92nd COVID-19 community briefing. First of all, we're going to start today with some statistics and start with our local scoreboard. In terms of the overall number of tests, Orange City Area Health System has had 1,793 positives out of 9,082 tests. That is a rate of 19.7%. Again, as you know, more importantly, we like to look at a week and 2 weeks activity. For the week, we have 13 positive tests of approximately 131 administered for a rate of about 10% for this past week. The 2 weeks prior to that have each been at 7%. So our rates are typically are down from where they typically were several weeks ago. In terms of Sioux County, again, we've been looking at the 14-day and 7-day average. First of all, the 14-day average is down again at 6.9%. Previously, we're at 8.2. 2 weeks ago, we were at 10.1, and 3 weeks ago, we were at 14.3. So very good numbers on our 14-day average. In terms of the 7-day average, good numbers as well. The 7-day average as of this morning was 5.2%. Previously, we're at 5.3, 7.2, and 8.5. Our percent positive per 100,000 population over the last 7 days is 106.0. That's up a little bit. From the previous 7-day period, it's up 55.4%. The number of individuals in the county are 4,664 positives of the 1,496 tested. For the week, that was an additional 34 positives in Sioux County, up from 33 a week ago, and down from 59 2 weeks ago, and 65 3 weeks ago. So 34 new positives in Sioux County this past week. In terms of Region 3, the 20 counties in Northwest Iowa, we are down to 29 hospitalized in Region 3, down from 32, down from 50, down from 76 3 weeks ago. However, we do have 9 people in the ICU in Region 3, and of those 9, 6 people are on ventilators. So again, a very serious situation relative to those patients on vents in the ICU in Region 3. Moving to the Iowa 14-day and 7-day averages, good numbers again and steadily going down. The 14-day average is 8.8%, down from 9.9, 11.0, and 12.9 3 weeks ago. The 7-day average steadily declining, 6.6%, down from 7.5, down from 8.5, and 9.2 3 weeks ago. The positive per 100,000 population over the last 7 days at the state level is 147. So Sioux County's at 106 is still significantly below the state. The state level of 147.0 is down just 0.76% from where it was. Actually, that rate over the last 3-4 weeks has been incredibly steady, less than 1% variance for the most part every week. The number of Iowans hospitalized somewhere with the COVID diagnosis is 316, 316. That is down from 358, 382, and 483 3 weeks ago. For the first time that I can remember in a long time, Sioux County has zero officially in terms of 0 residents hospitalized anywhere. Again, a reminder that we're not through this yet. We have had 5,108 deaths in Iowa. The first time we've climbed over the 5,000 mark. That is 202 more than a week ago. Again, I'm reporting the numbers as they're given. I think there might be some catching up with this number from the statistics, but nevertheless, I'm reporting the number that is on the coronavirus.iowa.gov website. When you look at the trend line for the graph, which is the 14-day rolling average, steadily declining, and to a point where it is really almost back to where we were in the late March, early April timeframe. So significantly going down, which is a good thing. The Sioux County death toll is officially at 66, and that represents 4 more than when we reported a week ago. So that's some statistics for you. Good news, and we're very glad to be able to bring that good news to you. Going to talk a little bit about a couple things that happened over the last week. First and foremost, last Friday, I believe, or maybe Thursday, we have a new proclamation from Governor Reynolds that will expire on March 7. So the new proclamation goes through that date. The old proclamation ended midnight Saturday, I believe. To be sure, it doesn't change a lot in terms of what we are doing here at the health system, but it does change a little bit. We are going to continue to screen employees at all healthcare facilities. That is still being required, and continue to encourage vigilance in terms of visitors and things like that. But we'll continue with the normal screening for all of our employees. All of our employees are screened daily, temperature and questions. Bed restrictions in terms of having to set some beds aside for ICU types of things appear to be lifted at this point, so we don't have to worry about that anymore. In the event that we do have some kind of surge, we remain in a position to have more than our licensed beds at this point, which would be more than 25 beds, so we can continue to increase that level if we need to. Visitor policies will be reviewed, will be loosened up a little bit if we can do that. We are reviewing that and are kind of taking a week or so to do that. The same is true with our cafeteria policies. We are going to review those. We're not going to jump right in and change too much right now. One of the things that might be the biggest change is that we may not be requiring the pre-surgical nasal swab any longer. We're checking with our surgeons, with our OR staff, with our other physicians, and making sure that that is something that we don't need to do. We will certainly be doing screenings, but may not be forced by regulation or by law to do the PCR test or any other kind of rapid testing. In general, this is going to take a little time to review some of the CDC guidelines. There are more things we have to follow than just Governor Reynolds' proclamations, and so we'll be following those. But the gist of the message today is that we seem to be in a period of transition. Maybe that's a week, maybe it's a couple weeks, but as we begin to transition through this, begin to seek out what the new normal is going to look like, we'll loosen things up, and we'll do that as responsibly as we can. Wanted just to give an update on Prairie Ridge Care Center and Landsmere Ridge Retirement Community also. One of the things to remember there is we are still under Department of Inspection and Appeals Authority, DIA, the Iowa Department of Public Health, IDPH, and the Center for Medicare and Medicaid Services, or CMS. Regardless of what Governor Reynolds might say in a proclamation, or regardless of the status of our vaccinations, we are still under requirement to follow those DIA, IDPH, CMS, those entities. We have been able to, though, loosen up our visitation policy a little bit at Prairie Ridge. For details of that, if you're interested in that, please call the 6000 number for more information. Again, 707-6000, and you can get some of the details of our visitation policies. It's a structured policy, and so you'll need to comply with that, but it is possible to visit someone at Prairie Ridge, but please call that number and get the procedures and protocols to follow. Landsmere Ridge is also transitioning internally. I'm not sure that there are things that I'll talk about right here, but again, if you're interested in learning more about that, you can call out to Landsmere Ridge and get that information. I think we're still limiting visitors in each person's unit to 4 and things like that, but certainly visitors can be at Landsmere Ridge under those procedures. Back to Prairie Ridge, we're about a day or 2 away from no longer having to test residents either, provided that we have no positives in the next day or 2. We're just about out of the period of time that we needed to be to make that happen, and that would be great news that we don't have to test residents weekly on a weekly basis. One of the reasons for perhaps one of the reasons for no positive COVIDs at Prairie Ridge is that we've had over 80 residents now that have received their second dose of the COVID vaccine through the Walgreens program. And so most of our folks, over 80 of them, have received that second dose on January 26th. And so we're basically through that 2-week period now, post second dose, that the maximum efficacy should be in play. And so that's a very good thing, and quite frankly, is leading us to loosening some of the visitation policies. But again, we have to stay within the CDC or IDPH and all those guidelines. The final Walgreens visit to Orange City is going to be on February 16th, and that will finish up with the people that did get their first dose on January 26th. But again, that's a small number, and also to take care of the second round of some staff members that got their first round on January 26th. In addition to Prairie Ridge on our nursing home, we have about 30 residents in our assisted living facility that are in the same situation, that they received their second dose on January 26th. If they receive their first dose on January 26th, they'll receive their second dose on the 16th. So good news at Prairie Ridge and Landsmere Ridge. We think we're in a pretty good spot relative to maximizing the efficacy of the vaccine at this point. Finally, today, I want to just mention the vaccination process here at the Orange City Medical Clinic. We continue to prioritize in the 65 plus group that is in the phase 1B level. We continue to do that and feel justified in doing that, quite frankly, because of the demographics in the deaths that we had, where in the state of Iowa, where 94% of those deaths in Iowa, those 5,000 deaths, are in the age 60 and above category. And so we will continue to prioritize in that category, as we believe other health systems are in Sioux County as well. We thought we were going to get about 175 doses for this coming week or this week, and instead we received 200. So that's very good news. We will be conducting our clinics as scheduled Wednesday, Thursday, and we will be scheduling some extra ones for Friday as we need to, and in the priority that the list was gathered. So we will continue to do that. Our goal is to end each week with 0 prime doses in play. And so we think we will be doing that. Again, as we look at prime doses or the first dose, we are not concerned, and hopefully you aren't either, about receiving the booster dose. The state allocations are separate, and we do have booster dose inventory here that we need to use for the second dose. That's kept separate from the prime dose that we receive. And so this week we received 200 prime doses. That does mean that in about 4 weeks, we should receive 200 booster doses to correspond to this week's allocation. To date, we've given over 1,000 first and second doses. So we believe we're getting the vaccine out there. We're getting it out as quickly and as responsibly as we can. We're making sure that it's in your medical record, that you have all the documentation, that it's in the state records, so that we're able to show and you're able to prove, certainly for travel or whatever you need to prove it for in the future, that that documentation is properly filed. And so we're doing that. We are expecting and have experienced about 300 to 400 doses per week when you look at the prime dose and the booster dose. So we've been giving a lot of injections. Our goal, and we think we'll be there at the end of this week, is to have 0 left. And future allocations, by the way, of the prime doses are if you have more than 20% of your allocation left, you're not going to get any for the week ahead. So it's not only our desire, it's our responsibility to make sure that we give more than 80% of that allocation every week. I guarantee you that will not be a problem. And our goal is much higher than 80%. It's 95, if not 100% each week to give that out. So that's it for today. The light at the end of the tunnel is getting a little brighter. We're not there yet. This is still going to be a journey that it's going to take some stamina, require some stamina. Things are loosening up a bit, and we're very grateful for that. We ask that you still, you're strong through this process. We're still slugging it out, getting through everything, to be responsible, to be vigilant, and we wish you nothing but good health. Thank you for listening today. We do anticipate a briefing again a week from today. If there's anything abnormal or anything interesting that particularly comes up that you need to know, we'll be sure to publish another briefing really whenever that happens. So thank you again, and thanks for joining us.